Hello everyone, Dumelang. Welcome to another edition of Sports Health Corner, where we answer all your sports medical questions. My name is Matlhomola Morake and I'll be your host. Please remember to go to our Facebook page and like the page. Don't forget to subscribe on our YouTube channel. And tell your friends about this show, by the way. If you found it interesting, the first episode, please do tell. Don't keep it to yourself. As you saw in the first episode, I don't travel alone. I'm with Dr. Thulani Ngwenya, our resident doctor. Doc, welcome back. Hi. And thanks for joining us.
Hi, folks.
Are you well?
Me, I'm very well.
You look very well, I must say.
I'm looking forward to the show. Thanks.
So, Doc, in the first episode, we laid the foundation as to what an injury is, what is sports medicine, and now that we passed all of that, by the way, if you missed it, you can go to our YouTube page. You'll find a whole episode of the introduction there. But now today we're tackling a topic that could save many a life.
Yes.
The easiest way to call it is pre-sport medical screening. And I know some of you are asking yourselves, what exactly is he talking about? But look, I'm not the expert. Here he is. Doc, once again, welcome back, and let's get into it. What is pre-sport medical screening?
Okay. Now, when you're talking, I'm going to dissect the pre-sport medical screening. Pre, it means before. Before you're actually involved in sport, you need to be screened. Screening, it means that you need to be examined from head to toe to check if you have got any issues, like you've got medical challenges like comorbidities, maybe diabetes, hypertension. You need to be checked as to whether you've had injuries before that are still there. So all those things are important, that you are screened. We have your database, we have your status, we know your status as to whether you are fit to actually go into sport.
Doc, are you talking here about professional athletes or non-professional athletes, or just talking about everybody that wants to do sport?
My advice is that everyone that is participating in sport must do pre-sporting screening. It is very, very important, because I'm just going to push in a topic of maybe sudden cardiac arrest. Sudden cardiac arrest can happen to a person that is not an elite athlete. So you can be a weekend warrior running and suddenly your heart arrests and then you die there because there's no support, there's nothing. But when you do your pre-sporting assessment, then you have a chance of then picking up things that might make you to be at risk of having a cardiac arrest.
So in other words, you're eliminating dangers that you could have as an individual.
Yes, you are spot on. We are actually eliminating the risk and managing the risk if there's a risk.
So if you don't do it, Doc, how dangerous is it, if at all?
If you do not do it, you're still fine. You can actually do more, because we've seen a lot of people would always say, but I've been doing this, we've seen people doing this, they've never had situations. But the danger is that there is that one person that will have a situation, and that might be you. So it is very, very important that you are safe than sorry. So like I said even in the previous episode, that in sports medicine we are more about preventative issues. So we are preventing injuries or preventing danger or preventing medical problems that might occur. So it's more about that in terms of sports medicine. The management aspect of it, it's really secondary. It's more about preventative issues.
So when you do pre-sport medical screening, what are you likely to find as a medical practitioner on an individual? I know you mentioned earlier sudden cardiac arrest, but what else are you likely to find?
Yeah, well, when you are doing pre-medical screening, it also, like I said, in medicine, it's very important to take history. You take history. It is very, very important, because when you take history, you ask about medical conditions that are there, if you have had previous injuries, if your parents have got medical conditions, or if they've also succumbed to medical conditions like your high blood pressure or your diabetes, because then you'd know that there's a chance if your parents have had hypertension, there's a chance that you might then, or if the parents had diabetes, there's a chance that as a descendant from the parent, you might also have developed that in a long run. So it is very important that to be flagged up, so that when we do the screening and taking history, we pick that up and then we investigate you accordingly. So when you're doing the screening, you are, firstly you start with the head. You do your baseline assessment in terms of the head. We do baseline, like for instance, we do a SCAT-5 assessment as a baseline. SCAT-5 assessment is for concussion. It's an assessment for concussion because when you do SCAT-5, you'd want to, when you're managing them, when they now have a concussion, you want them to manage them such that they go to your baseline where you pick them up when they did not have a concussion. So it also helps us with such issues. And then for female athletes, for instance, female athletes, we know with their cycles, most of the time they've got iron deficiency anemia. Yes. So you'll pick that up from clinical assessment. You see that they are pallor, they've got discoloration of their eyes, they are pale, you know. So that then will then say, no, maybe do an investigation, do iron studies, check what's the iron level, and then with that, then it helps you to correct that, because when they play with not enough iron, because you remember that iron is quite important with the hemoglobin process, yes, and the oxygen carrying capacity, because as an athlete you need your blood to be oxygenated so that it is fueling all your muscles, and if you do not have enough, then you'll suffer from injuries, you'll suffer from cramps, you'll suffer from all these other things. So it is very, very important that you know that when you're about to start, all those things are picked up and they have been managed accordingly. For instance, you mentioned cardiac arrest. With cardiac arrest, you'd want to also look at the heart condition, rule out risk factors, even if they are congenital or if you've got, but we're gonna talk more about cardiac arrest when we get to that topic. I'm just giving an overview. For instance, also, it is important, maybe you're a weekend warrior, so we need to know, you need to know that how is your balance? Are your legs equal? Because if you don't have equal legs, then you might be at risk of developing injuries, you know. Such things are very, very important. How do you run? The way of running, how is your muscle bulk, you know, because if you've got maybe some calf is less than the other, then you need to balance that so that you avoid injuries. So all those things you pick up when you do pre-sport screening. So it is very, very important.
So Doc, I'm sitting here and thinking to myself, this must cost a fortune, and probably there's someone watching this saying, how am I gonna afford such a thing?
Yeah, well, it is. Yes, it does cost money, I must say. We are specialists, so it does cost money, but it is important. When you look at the financial aspect versus the benefit, the benefit is more than the 800, for instance, that you might spend for doing that. 800 is just medical examination, but when you need investigation, you have to pay more, because you have to send you to the lab, we have to send you, maybe we'll have to send you to x-rays or scans, so that then we'll pay more. But the basic medical screening is about 800 rand. Now, if you do not do the screening and then you go and you collapse and die, you have lost a life, as compared to paying 850. So what is better? So I would always say, let's go and do the right thing, and then you know that you're safe. Even though in medicine there's nothing that is 100%, but at least you would have eliminated most of the risk.
Very, very, very interesting there to say that your advice basically is to say, go for it. If you can afford it, go for it. But now, Doc, you're talking pre-sport medical screening, and there's also, on the other hand, pre-competition medical assessment.
Yeah.
Are we talking about the same thing? Are they any different?
Well, pre-sport screening is not as detailed as pre-competition medical screening, because one can say pre-sport medical screening it's a broader term to say for a non-elite athlete. You can do some of the things, but there's some things that you really don't have to do. Like for instance, echocardiogram for non-elite athletes, checking the condition of your heart. If you do ECG and your ECG is normal for non-elite athletes, then somehow we are okay. But for instance, with the competitions like your FIFA competitions, like your CAF, like your Olympics, they are very, very specific that you need to also do echocardiogram over and above an ECG. You can have an ECG that is normal, but over and above that, they need you to do a detailed assessment, which is an echocardiogram, of which for a non-elite athlete, you wouldn't really do. And for a non-elite athlete, you'll just do your head-to-toe examination. You would really not go into detail, like for instance, a weekend warrior. You wouldn't really do a SCAT 5 assessment for those, because they are running. The chances of them having a concussion are they are close to 0, you know, but it doesn't mean that they can't have a concussion. But it's a different subject again, that will be discussed at that time. So for pre-competition medical assessment, that one is a requirement for a particular competition, and it must be done. It's compulsory. But for sporting screening, that one is up to you whether you want to do it or not. But we are always saying that please do it when you are actually going to be involved in sport. But for this one, it's compulsory. It must be done.
Doc, if you can just summarize this for us. A group is sent to you to do pre-competition,
yes,
medical screening, and then an individual or even another group, yes, is sent to you to do pre-sport medical screening.
Yeah.
What goes on between the two? You can just briefly summarize as to say, for this group, this is what we will do, and just touch on several aspects of it, and on the other side, same thing.
Okay. I've tried to touch on the pre-sporting screening mostly. Let me dissect the pre-competition medical screening. It is an 18-page document that has to be filled. Now, the first part of it is history. Everything starts
again
with history.
And
in the history, we want to know about your medical condition. If you've got any medical condition, like for instance, you've got hypertension, you've got diabetes, you know, you've got high cholesterol, all those things, it's important. Then from there, you want to know about your parents and your family, if there's anyone with that particular condition, or if there's anyone that died from such a condition. It is very, very important. And then from there, we go down, we talk about medication. Are you taking any medication? Because that is also very important. Because now in sport, we are talking doping. Yes. So there's some medication that are allowed for a general person that is not an elite athlete. There's some medication that is banned in sports or in particular sports. So it is very important that we take history of medication as well. And then from there, we go to injuries. Now we check in terms of injuries, whether you have had any injuries before, and if you have had injuries, is this the injury did it need operation or not? It is very important. And how was it operated, and who operated? It's also important who operated. And then after that, how was the rehabilitation post-op? So it is very, very important. And how long were you out of action before you came back? And then since then, after your rehabilitation, did you do any rehabilitation or not? Because it's also important that we know that whether you were properly rehabilitated, because if you are not properly rehabilitated, there's a risk of recurrence. So we need to flag that up. Now, you also need to then go to details as to how were you graduated back to playing again. So it is also important. That is history in a nutshell. Now from there, we start by doing your normal examination, checking your blood pressure, checking your height, checking your weight, because that is important also, so that we actually check your BMI, whether you are underweight, overweight or normal, or you are obese. So it is very important because we want to manage holistically. So when we have an obese person, then we have to push them towards normal, you know, and that then the nutritionist comes in when it comes to management. So it is important that we pick up all those things. And then from there, then we're going to do you check from the head. We check your eyes if you can see properly, if your eyes are fine, you don't have squints, you know, it is very, very important. We check if you have got any problems with your head, you're suffering from intermittent, every now and then there's headache coming. We check whether you can hear properly. Then you go down to your chest, or before you go to your neck, check if there's any problem, discomfort, and then you go to your shoulders, go to your chest, you check the lungs. If the lungs there's equal air entry, you check the heart, if the heart sounds are fine.
So if the athlete is smoking, you can detect that?
Well, most of the time we'll pick that up from the history, because smoking is one of the things that we ask for. But if they are chronic smokers, sometimes then you can pick up a wheeze, you know that there's something wrong. So you check your heart, you check your abdomen, you check the limbs, both upper limbs, I mean your arms and your hands. You go down, you check your thigh, before you check your waist and everything around the waist, go down, and you basically go from head to toe. You go thorough. And over and above that, there's some investigations that are done in elite athletes in the PCMA. You need to do bloods. Bloods are a must, where you check your full blood count, checking whether you are anemic or not, you know, such things, checking your electrolyte imbalance, because, you know, for elite athletes, they run a lot, they lose salts. So that losing salts and having the imbalance of your electrolytes, then you have a problem, because if there's an imbalance of electrolytes, then you are at risk of developing cardiac arrest, because then again the electrolyte imbalance causes some electrical disturbances in how your heart is pumping out blood. So you are at risk of that. So it is very important that you do the blood. And then again, I've spoken about female athletes. And then over and above that, then you have to do the ECG, checking your heart. You have to do, in the bloods also you have to do cholesterol, because cholesterol is also important, because then it will tell you if you are at risk of having a heart attack. And from there you check. We don't do X-ray as a standard basic assessment, but over and above that you have to do your echocardiogram. And now of late, PCMA, you have to do your COVID test. So that is in a nutshell. But for a weekend warrior, you will really not do COVID test if there's no symptoms.
So as you said, the cost there is enormous, but it's something that has to be done.
Yeah, you know, for a PCMA, a thorough PCMA, it's not your normal 800 like what you do for your weekend warrior.
You're looking into thousands here.
Yes, of course.
So in the event that a team is sent to you for a PCMA and you detect that something is wrong, are you as a doctor able to rule out that player from going to tournament or competition, or you just give the information to the team and then the team will make that decision?
It is a legal obligation to flag up to the team that I am not, because remember, at the end of the PCMA, you have to sign that the player is eligible to compete or not. So where you sign, then you would say, according to your assessment, the player is not eligible to go and compete because of the 1, 2, 3, and 4 that you have picked up. So then it becomes then the responsibility of that particular team as to whether they are withdrawing or not. Because from as doctors, we might not have the right of imposing on what should happen. But as doctors, we use our expertise to advise. So we advise, because you can have a player that has got some heart problems, and you say this player is not eligible because they've got some heart problems, and the team decides to play them. Your responsibility is to advise, but the responsibility at the end of the day lies with the team, and the responsibility also lies with the player, because it's their life at the end of the day.
In the event, Doc, and we'll talk more about cardiac arrest, sudden cardiac arrest in the upcoming episodes. In the event that you sign that player A or B is eligible to play, and he goes into competition, and they get, or they hit by sudden cardiac arrest. Does it come back to you?
It has to, because when they do investigations, they would want to know if this player was screened or not. That is why we sign, and you also put your stamp there to say that indeed you have done that. So it will come back to you. That is why, again, as medics, you need to keep records that this is what I've done. Now, I want to talk about another aspect, just to make a practical example. With the under 17 wrist MRI for eligibility that we usually do for a competition of the under 17, I can do an assessment now, an MRI now, and find that that athlete is a grade 5. The athlete is eligible according to the assessment and the regulations. But a week later, when they're in competition, then they develop from grade 5 to grade 6. And when now you have cleared them to actually go to competition. Now, when you do not have records, you can be taken to the cleaners. But if you then have, that is why it's important to keep records. In medicine, we are taught that, you keep records for 10 years. But in occupational medicine now, you have to keep the records for 40 years. So it is very, very important.
Hold on.
To
How many years?
40 years in occupational
As in
medicine.
40?
40.
And why the discrepancy?
It's not a discrepancy per se, because there's more litigation in occupational medicine than in general medicine.
Very interesting.
Yes.
40 years compared to 10 years.
Yes, yes. For example, in the COSAFA tournament, we had some teams that were disqualified, like Botswana and Swaziland. And what is actually interesting is that the team from Swaziland sent me some of the images that they were not sure of. And my advice specifically was that this player is close to a grade 6. Rather, don't send this player, because you might be at risk of that player developing into a grade 6. And when they are a grade 6, then they are ineligible. And as per CAF regulations are saying that if one player is ineligible, then the whole team is disqualified. So I advised, and there were records of that. But they still decided to send the player to the competition. And when we made an assessment, and that was like 2 weeks later, when we made an assessment, the player was now a grade 6. And unfortunately, that team was disqualified. Another example, in West Africa, my colleague saw 5 Gambian athletes, and I think 3 Mauritanian athletes that were grade 5 at that time. And they were eligible to play. And he said that indeed they are eligible to play. But fast forward 3 weeks later, it was competition, West Africa under 17 tournament, qualifiers for the main under 17 tournament. All of them were disqualified because they had graduated to grade 6. So with growth and bone growth, because it's a growth plate, you can't really estimate. So to be safe, for those that are close to grade 6, that are grade 5, it's always best that you actually leave them out. And again, I also need to educate people that that does not mean that they are older than 17. It is an eligibility.
In fact, that's a very important point.
It is an eligibility assessment for an under 17 tournament. It does not mean that they are older than that, because with us as Africans, we grow differently. We've got different genes, and we are looking at a wrist. Some Africans would work quite a lot, then that means that even their bone structure will be more rigid as compared to others. And some grow differently. And even in nutrition, if with proper nutrition, then you might grow fine. With improper nutrition, it might not, even your growth is affected. So with that, it is very, very important that people understand it's assessment that is done for eligibility to play in the under 17 tournament. It does not mean that you are older than 17. So that must be clear, because we do not want the situation saying that no, these people were disqualified because they are old. No, we do not want people, we do not want to demotivate players.
But it's a very tricky area, even for the medical profession, to say, this player is on grade 5. How soon will they get to grade 6? Because it could happen, as we say,
yes,
in a week or 2 or even a month.
Yeah, because it depends on how you grow. Like for instance, I shave my hair, say I shave my hair today, I can't predict that the first hair to come out is tomorrow or the day after tomorrow or the next 8 hours. I can't. You really cannot. You can have some sort of indication, but to be safe, rather not take that risk, because if then that person grows to grade stage 6, unfortunately the whole team become disqualified. It was better if then we had a situation where we can take a risk to say they are grade 5, they might be still eligible 2 weeks time, and then when they disqualified, it's only them, not the whole team. Then it's better. But then when you have got the risk of disqualifying the whole team, sure, that might cause more harm.
Yeah, it should indeed. I think it's a topic for another day, though. I think they should seriously look into disqualifying 1 or 2 players, so those that are affected, not the whole team. But as I say, it's a topic for another day.
Yeah.
Anyway, Doc, I think we've come to the end of our episode for today. Thanks again for your time. See you next time as we tackle another topic here on Sports Health Corner, where we answer all your sports medical questions. Please go to our Facebook page, the Sports Health Corner, like the page, and don't forget to subscribe to our YouTube channel. And as I said, if you missed the first episode where we did a lot of long introduction, you can go there and you'll find it there. If you have questions or comments about the topics we've dealt with, do drop us a note in our Facebook page, and we'll gladly try and answer as much as possible in our upcoming episodes. And if you want to again consult Dr. Thulani Ngwenya at his practice, please go to our Facebook page. We've got all the information there, all the details are there, and you can just give them a call, make an appointment, and they will gladly help you. Once again, we are the Sports Health Corner. We answer all your sporting medical questions, and remember, this is my show, this is your show, this is our show. Stay safe, stay injury free. I'm Matlhomola Morake, and I'm out.